Let's come back to Johannesburg now, and the news that it may take up to 2 years before Charlotte Maxeke Hospital is fully operational again. You'll remember a fire in April destroyed a large part of the facility, but in recent months, parts of the hospital have been reopened. So at the moment, the hospital can treat 380 outpatients a day, but we know that this is a 1,000 inpatient bed facility at least. So eNCA reporter Khayelihle Khumalo has been following that story for us, and he joins us now. So Khaya, just talk to me about exactly how many beds are available in this facility at the moment.
Well, that's right, Sally. So generally, on average, this particular facility will just be able to look after 2,000 patients per day. But of course, in light of the fire and the blaze really that gutted the institution, now that number has been reduced quite considerable. But also they do talk about a number of assessments that have been conducted. So hence now the developments around the fact that now it's going to take quite a number of years to make sure that their structures are quite sound. But also in terms of compliance in this regard, the city of Johannesburg is a custodian of so many acts in terms of making sure that they do comply with that. So we got an opportunity to speak to two MECs for infrastructure development, Ms. Mutara, and she also gave us an indication that obviously there are quite a number of challenges that they are facing, especially since they've partially reopened the hospital. So per day, they look at over 300 patients. The oncology unit, among others as well, have been brought back into the stream. And we spoke to the health MEC as well, Sally, and this is what she had to say.
We have started admitting patients at Charlotte, but we are admitting patients through Helen Joseph. Currently, we have, I think, more than 500 patients at Charlotte of different categories. And then, on average, we are admitting 381 patients. And then we also have, as of yesterday, 216 COVID patients. And then those who just come to collect their medication from the pharmacy, we have seen so far 2,800. But when Charlotte was functional, we used to see on average patients, more than 2,300 patients. But because the casualty and the OPD is right up where the fire started, so currently we don't have an OPD or casualty. So hence we are using Charlotte, we are using Helen Joseph to admit patients there.
Yeah, and of course this fire came at the worst possible time, and it caused such a problem during the peak of our third wave here in Johannesburg. So 2 years before the hospital is fully up and running again, Khaya, is that simply because everything has to comply? Otherwise, essentially, it becomes an illegal building, which means legal loopholes and potential real hazards for people who inhabit that building.
Well, Sally, I think in the main, so far the investigations are still underway. In fact, it was one of the primary questions I asked the MEC responsible for infrastructure development, and she said the South African police service are still seized with that particular issue. But it's quite concerning because also today, just a short while ago, there was a statement from the health department where they indicated that there was a looting incident where some of the equipment were stripped away and taken away from the facility. So it is a cause for concern, especially because it's a very extraordinary time in the country. We still do have COVID-19, as much as the cases have declined quite substantially, but it's still a cause for concern. And we do know the reputation of Charlotte Maxeke Academic Hospital. They do have quite a number of workers who always work around the clock in dealing with the pandemic. And so far they say, for example, yesterday they saw about 260 patients being admitted and treated for COVID-19. But this is what MEC Mutara had to say.
We would have wanted to work in the hospital with it 100% unoccupied. That allows us to have contractors in the hospital 7 days a week, up to 24 hours a day. When you have operations and when you have a facility operational somewhat, that plan becomes hampered. So if you have patients, you've got to take into consideration patient care. So you can't have contractors busy working 24 hours a day. You also have to take into consideration factors such as dust and noise control and pollution control. And then of course, because you have patients in the facility, there's periods of patient rest that no work can be done by contractors. So we now, for all intents and purposes, are working on a live site where you have patients, where you have visitors in and out, and because of that, it reduces our work time quite considerably. We can't work like we worked at the oncology unit. We were able to work 24 hours a day, 7 days a week, and we were able to. The turnaround time was very, very quick. Unfortunately, with the rest of the hospital, we won't be able to do that.
Yeah, so it could be another year or two before that hospital's fully up and running again. Thank you very much for that update, Khayelihle Khumalo.